Botox botulinum toxin A is a medicine for adults with chronic migraine, which is migraine with 15 or more headache days a month, with each headache lasting 4 hours or more. Botox is not approved for adults with migraine who have 14 or fewer headache days a month.
My name is Kelly, and I'm from Springfield, Missouri. I'm very close with my family. We like to spend a lot of time together. I'm especially close to my sister. She's very supportive, and she's somebody I can always count on. I remember my first migraine. I was in my early 20s. I wasn't sure exactly what was going on. I had a terrible sharp pain right over my left eye, very sensitive to light. I didn't know why. I only wanted to be in a dark room. That was my first migraine. After that, my migraines and headaches started to happen more frequently and more often, and they really came back with a vengeance. I even had to stay home from work sometimes because the symptoms were more than I could take. It was at that point that my doctor put me in contact with a specialist at the local headache center. This was the first time I've had somebody explain to me exactly what had been going on, not just at this time, but over the last 10 years. I would have a migraine and then a period of time where I wouldn't have headaches or migraines, and then I would kind of keep repeating that. And that is what they call it, episodic migraine. Now that they were basically so close together that I was having them nearly a daily basis, or 15 or more a month, now I actually have chronic migraine. After my diagnosis with chronic migraine, my headache specialist recommended a different type of medication to try, which was Botox. He told me it was the only medicine specifically approved to reduce the number of headache days. Once my headache specialist recommended Botox, I wanted to go ahead and do some research and check it out to make sure it was okay for me. So I took home the brochure that my doctor gave me and looked up more information about it. After I did my research, I met back up with my doctor. We went over the risks and the benefits again, and we decided that it was the right option for me. I was a little bit concerned about how I was going to pay for it. I wasn't sure if insurance was going to cover it and how much. Happily, my insurance covers a good portion of the cost of treatments. The doctor did tell me about a program that Botox offers called the Partnership for Access program, which helps cover some of the out-of-pocket expenses. Between insurance and that program, it was affordable for me. Look, I lost out on a lot of activities in the past because of my chronic migraine. One that I'll never forget is that my sister ran in a marathon race, and while my entire family was there cheering her on, I was home in bed, curled up with the lights out, not able to go. It was really hard for me to know that I had missed something that was so important to her. These days, I'm making fewer marks in my headache diary, and there's some days where I don't even make a mark at all. And that's so exciting to me because I didn't think that there was going to be a time where I was ever going to have that.
Botox is a prescription medicine that is injected to prevent headaches in adults with chronic migraine who have 15 or more days each month, with headache lasting 4 or more hours each day in people 18 years or older. It is not known whether Botox is safe or effective to prevent headaches in patients with migraine who have 14 or fewer headache days each month, episodic migraine. Important safety information. Botox may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks, after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. There has not been a confirmed serious case of spread of toxin effect away from the injection site when Botox has been used at the recommended dose to treat chronic migraine. Botox may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, abobotulinum toxin A, or Xeomin, incobotulinum toxin A, have a skin infection at the planned injection site. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received, have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide.
My advice for people with chronic migraine, ask your doctor about Botox treatments.